One question that I get commonly is, what is the association between eczema and food? Families come to see me, their babies and young children are really struggling with their eczema, they're itchy, they're up all night, and families are desperate to find the root cause of it. What could the child be eating that's making their skin do this? In most cases, there is not one culprit, there is not one food. I honestly wish that there was. I often tell families, do you know how much easier my life would be if I could just tell you to avoid this one thing and all the eczema will go away? It's actually quite uncommon for a food to be the cause of eczema. We see it sometimes, particularly in little teeny babies that are dealing with eczema and GI issues such as diarrhea, mucousy diarrhea, bloody diarrhea. Often that's a sign of a dairy protein allergy. But most times there is no cause with a food linked to the eczema. The interesting thing is that more recent research is showing us that the eczema might actually be causing the food allergy. That aerosolized food particles are able to enter through the skin's broken skin barrier because the kiddo has eczema, and trigger an abnormal immunologic response, which becomes allergy. And there's even a study showing that if you treat your child's atopic dermatitis, you're less likely for them to have food allergy. So the best thing you can do to prevent food allergy is treat your kiddo's eczema and make that better. In addition, because it's so rarely a cause, we don't recommend elimination diets. We know that the more you avoid a food, the more likely you are to have an allergy to it. So we don't want that to develop. So we encourage introducing foods in a normal way to a kiddo because they need their nutrition from multiple sources, and we know that avoidance is linked to an increased risk of food allergy. When it comes to diet and dermatology, we're learning a lot. We certainly don't know everything, but a few things have been studied and are things that we can share with patients and their families. When it comes to psoriasis, we know that taking fish oil or eating fish can be helpful. We also know that a couple different spices can be helpful. These are curcumin and turmeric. And so integrating these things into your diet can help the inflammation of your psoriasis. We also believe that there might be some power in a Mediterranean diet. Mediterranean diets are considered less inflammatory, and so there could be some benefit to something like that. When it comes to diet and other skin conditions like acne, we get questions about that all the time. And I've been in practice for the past 14 years, and I have seen the pendulum swing back and forth about the relationship between diet and acne. And to be honest, I'm not sure we really have the answers yet. I've gone through times in my career where we thought diet was definitely a factor, and times where we thought diet was definitely not a factor. And I think the pendulum is still swinging. Right now, the current belief is that diets that are high in carbs and sugar could create more acne in a susceptible individual. And what I tell my patients is this doesn't mean you can never have a cookie, but it means that everything in moderation is a good policy to follow. You shouldn't be existing on pizza and French fries. Have a little bit of this and a little bit of that, and that's likely to work out okay. There is one condition in dermatology that is directly related to food, and it's something called dermatitis herpetiformis. Dermatitis herpetiformis is not a common skin rash, but we see it in our clinics here in the dermatology practice. And it causes these bumps and blisters, classically on the elbows, knees, sometimes the back of the head, sometimes the lower back. And these areas are incredibly itchy, like 10 out of 10 itchy. Dermatitis herpetiformis is one of the itchiest conditions that we treat. And dermatitis herpetiformis is directly related to a gluten sensitivity. And so people with dermatitis herpetiformis are more likely to have celiac disease. And so we tell our patients with dermatitis herpetiformis to avoid gluten and be on a gluten-free diet. So that is one example of a skin condition that's directly due to a food.